Hello, my name is Dr. Olubukola Ayodele. I am a consultant medical oncologist. In this video, we're going to learn about the side effects of chemotherapy and how to cope with it. You would also hear from Mariam, who is going to share her experiences of side effects she had with chemotherapy. Chemotherapy is an anti-cancer treatment. They use drugs to damage cancer cells. Cancer cells are rapidly dividing and go round the body, and this is where chemotherapy comes in because it's carried through the blood. Because chemotherapy can affect healthy cells, you might get side effects. However, most of those side effects goes away after the treatment. The side effects of chemotherapy you might experience depends on the cancer treatment that you're getting, whether it's a single drug or if it's in combination. If it's in combination, you might get more side effects than if it's a single drug. Also, if you're getting high-dose chemotherapy, you might experience more side effects. Your cancer team would go through the potential side effects that you might experience, but remember, you might not have all of those side effects. Chemotherapy affects different parts of the body. It affects mostly rapidly dividing cells, such as bone marrow, the digestive system, and hair follicles. Bone marrow is where blood cells are made. Chemotherapy affects the bone marrow by destroying the cells. There are three main cells produced by the bone marrow: the white blood cell, the red blood cell, and the platelets. The red blood cells carries oxygen around the body. The white blood cells help to prevent and fight infection, and the platelets helps to clot and reduce the risk of bleeding. The side effects of chemotherapy on the bone marrow includes an increased risk of infection, a condition called anemia where you feel more breathless and more tired, an increased risk of bruising and unexplained bleeding such as gum bleeding or nosebleeds. You will have regular blood tests to check the levels of these blood cells. If you have a reduced white blood cells, then you're at risk of infection. Some people might be given injection to help boost the white blood cells. Others might be given antibiotics to help prevent infections. Some chemotherapy drugs can affect the hair by making it brittle, thinner, or dry. It can affect hair all over the body. It can also lead to hair loss in some situations. Hair loss typically occurs few weeks into chemotherapy. However, you might notice it even a few days after treatment. You might notice the hair loss when you are washing your hair, combing your hair, or you might wake up in the morning and find hair on the pillow. Depending on the type of chemotherapy and the type of cancer you might have, you might be able to reduce or prevent hair loss by using a cold cap. The cold cap is scalp cooling that helps to reduce the amount of chemotherapy going to the hair follicles in the scalp. You can speak to your cancer team to see whether this would be appropriate for you. Hair loss can be very upsetting for many. However, you can use wigs, scarves, hats to help with this. If you choose not to, you still need to look after your scalp.
Hi, my name is Mariam and I was diagnosed with Hodgkin's lymphoma in November 2020 when I was just 18 years old. So I was diagnosed 9 days before my 19th birthday and I had just started university to study my law degree. So one of the main side effects that I suffered with during my chemotherapy was hair loss. My hair was quite long and this was a struggle for me to lose. Just before I started my chemotherapy, my consultant advised me to cut my hair short to take some of the weight off. I was also referred by the hospital to the Little Princess Trust, who provided me a wig free of charge. I also used to try and do different things to make myself feel a bit more confident whilst dealing with the hair loss. So I used to have nice little hats that I used to wear and cute little turbans, and that was something that really helped me to overcome that side effect.
Hi, my name's Paige and I'm a chemotherapy sister. Chemotherapy can affect your digestive system, and this is everything from your mouth down to your bowels. You may experience a sore mouth, mouth ulcers, and even thrush. For some people, food might taste differently. You may also have diarrhea, constipation, you may also feel sick, or you may also vomit. All of these things may affect your appetite and you may not feel like eating. If your chemotherapy causes sickness, you'll be given anti-sickness drugs before you start your chemotherapy.
I also really struggled with nausea and sickness during my chemotherapy, and this was something that I struggled with through all my rounds of chemotherapy. And this meant essentially that I lost my appetite. I couldn't really eat the foods that I used to enjoy before, and this made me feel quite upset. And my cancer team offered me quite a few alternatives and different anti-sickness medication. Some of them worked and some of them didn't. My cancer team also recommended me some things that I could do at home to try and help the nausea and sickness. I was recommended to take and try ginger biscuits, but unfortunately this didn't work for me. My cancer team also recommended that I try having chewy sweets during my treatment and before my treatment, and this was something that really helped me to manage my nausea and sickness and overall my appetite. During my chemotherapy, especially during my first 2 rounds, I really struggled with mouth sores. My hospital team recommended for me to have a nutritional drink and added ice cream to it, and I used to drink this using a straw. During this time, I also stayed well hydrated and drank loads of milk and soft sort of food and also liquids.
Side effects are often mild and easily treatable. Your cancer team will be able to prescribe you drugs that will help with these side effects. There are many different other side effects which are harder to control. If you let your cancer team know, they'll be able to advise you on what to do and what to take to aid these. A lot of side effects can be unpleasant, but please note they do go away and they usually stop once you've finished treatment. The benefits of chemotherapy often outweigh these side effects.
From the beginning of my treatment, I struggled quite a lot with nerve pain and nerve damage. I had a lot of numbness in my fingers and my toes, and by the end of my chemotherapy I had darkening of my fingernails and my toenails. This led me to not being able to have sensation in my fingers and my toes when I was walking around. I couldn't really pick things up and I had really bad shaking. The nerve damage was a symptom that I had learned to deal with during that time period, as there was nothing that I could really have done during this time except wait for it to subside.
Late effects of chemotherapy is when side effects do not go away after months or develop years after having chemotherapy. This includes effects on fertility or effects on the heart and lungs. Late effects of chemotherapy can be minor and not affect your quality of life very much. Some go away over time, however, some can cause difficulties. Discussion with your cancer team can help you find ways to cope with this.
So I'm 5 years post-diagnosis now, and I struggled with some late side effects. Before I started my treatment, my consultant told me about my fertility potentially being impacted in the future. I was then sent to a private hospital to get an egg retrieval done, and this essentially would help preserve my fertility for the future. During my treatment as well, I was given injections to help protect my ovaries and my fertility during this period, because with all the things that are going on in the background after receiving your diagnosis, it's really important to be as well informed as possible about all the treatment options and fertility preservation options that they have available before starting your treatment.
Side effects of chemotherapy may also impact other aspects of your life. This may include having to take a step back from work, socialising, and also impacting your finances. Please contact your cancer team or your GP to get support. For more information, visit macmillan.org.uk or call the support line on 0808 808 0000.